Hello, I'm Marcus Boston. Quick video today, and we are going to talk about a baby's HIE, injury at birth, and the role of labor and delivery nurses. The reason why this is important is because when we talk to families, sometimes what it seems like is that their understanding is that the labor and delivery nurse, they're just there to just do essentially what the doctors tell them to do. And the truth of the matter is that the labor and delivery nurses, they have their own independent duty to the patient. Essentially, their job is to take care of the patient. The doctors and the hospital staff, they are secondary. The labor and delivery nurses, they have their own independent duty. They have their own standard of care issues that they have to follow. So how this can play out is, let's say you have a situation in which mom and baby, they're going through everything, and the nurses, they're watching the readings on the electronic fetal heart monitor. These labor and delivery nurses, through their own training and their own understanding and expertise, they understand how to read fetal heart strips. They understand the role of the electronic fetal heart monitor. If during this process, the nurses feel that this strip is in a non-reassuring pattern and they have alerted the doctor who's in charge and that doctor of the patient, and that doctor, it seems that that doctor is not looking out for the best interest of the patient, or they're not getting any traction based on their concerns, the nurses have their own ability to go over that doctor's head or to initiate what we call their chain of command. And this chain of command can be inserted in through a hospital's protocol and through the hospital's directives. And so when labor and delivery, if things are going on and they're not going the right way and the nurses are concerned about what's happening to the baby, they have their own independent duty to act. If nurses do not act accordingly and they deviate from their standard of care, causing the child's injury, then those nurses can and will be held responsible for their actions. If you have more questions as it pertains to this video today, there's a telephone number down below. What I would invite you to do, go and pick up the phone and call me. I speak with families like yours all the time about these issues. Go ahead and call, speak to my office, tell the secretaries that you would like to schedule a conversation or a consultation with me or my co-counsel Renee Boston on the phone. Let the office staff, let them know that. All right, one more thing. I practice law here in the state of Maryland, and if you are not in Maryland and you contact me, understand that we have to use what we call co-counsel or local counsel. In other words, an attorney in your state, and that's something that we can help work with you on. But I just want to make sure that if you're not in Maryland, that you understand the co-counsel aspect of things. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here in the state of Maryland at Boston Law Group, LLC. We'll talk with you next time. Take care. Enjoy the rest of your day.